we're going to transition to our first topic today. Before we do that, I want to encourage everyone to go on the chat with your name and your organization, the state you're in. We want to know who's here. I see we have almost 140 participants online, and so please go on the chat and let us know who you are and who you're representing, and we'll have that much better of a record of what's going on. So we're going to talk now about managing CARES Act funding. In March of 2020, Congress passed the Coronavirus Aid, Relief, and Economic Security, or CARES Act. It provided public transportation with significant levels of funding to address the COVID-19 pandemic. Since its adoption, states have had ongoing discussions about strategies and methodologies for implementing this program and administering this transit funding, especially in our rural and small urban transit systems. The CARES Act has proven critical for maintaining a strong federal commitment to safe and continued public transportation during the pandemic. It certainly hasn't met all of our needs, but it has been a huge, huge boost to what we do in Washington state. We were hit early and hard by the pandemic. Our revenues went down precipitously in March and April. We were at the previous depths of the pandemic. We were losing statewide over $100 million a month in funding for transportation because people weren't driving and buying gas and paying gas tax. People weren't riding transit and paying the fares. People weren't riding our ferry system or using our toll roads, what have you. And the CARES Act came in and provided a much needed relief valve for all of that. We have been working at the DOT, obviously the large agencies got their money directly, but we manage the distribution of funding for our small cities and rural transit systems. We also the DOT operates the Washington State Ferries, which is the second largest ferry system in the world and the third largest transit agency in Washington state. So the CARES Act was instrumental in keeping us afloat, if you will, as we move forward into 2020. We're ready for a little more relief and hoping that the Congress is receptive to that idea as well. Before I introduce the panel, I would encourage all the attendees to think about their own experiences and what, if any, changes or improvements should be made for future emergency relief bills and even the next surface transportation bill. We've been having a conversation in Washington state with our transit agency partners and others on rethinking transit and mobility as we come out of the pandemic and anticipate a post-pandemic world, with workshops and surveys, representatives from transit agencies, local and county governments, regional and metropolitan organizations, tribal planning organizations, human services providers. We sat down and talked about what does public transit need to think about to pivot and bounce forward, if you will, rather than bouncing back to where we were. Let's bounce forward to a better thing. And some of the recommendations that have come out of Washington State's conversation are things like establishing a baseline for minimum service and securing funding to ensure that level of service across the state. Applying demographic equity criteria to funding sources to prioritize projects that serve vulnerable and underserved populations. Ensuring that people with special needs can access goods and services and jobs. One of the great things about our rural system during the depths of this, and again in partnership with FTA using some of the CARES Act funding, some of our rural transits were able to deliver prescriptions to shut-in seniors and deliver food to people in need, which was a great thing to see. We need to develop, obviously, new revenue models for funding public transportation, and we need to develop policies and funding sources to support all-day transit, because we're finding that increasingly the home-based work trip is less and less of the overall transportation world. And so all-day service is going to be increasingly important. So those are the things we're talking about in Washington state. I would encourage you to give some thought to what you're talking about in your state and share it as we discuss here today. So to introduce our panel, our expert panel includes Bruce Robinson, Associate Administrator, Office of Program Management at the Federal Transit Administration, Garrett Euclid, the Deputy Commissioner of the Connecticut DOT, and Suzanne Carlson, the Multimodal Transportation Resources Division Director at Tennessee DOT. So we're going to hear presentations from each of our panelists, and then we'll do some Q&A as time permits. So panel, take it away.
So good morning, everybody. I'm Bruce Robinson. I'm FTA's Associate Administrator for the Office of Program Management. I'm going to talk about our CARES Act funding, as well as provisions of our emergency relief program that allowed flexibility for the use of other formula funds. Can you go to the next slide, please? Probably want to talk about some of the challenges that the industry is facing that really identify the need for the emergency relief and the COVID funding. We'll talk about the financial assistance we provided. We have a little timeline. As I mentioned, there are also eligibilities under our emergency relief program that we were quick to introduce even before the CARES Act. I'll talk specifically about what's in the CARES Act and other relief that we provided, and looking forward to the potential future appropriations. Next slide. I mean, these financial challenges are obvious to many of you, but they're worth stating. Of course, we have the challenge of lost revenue, lack of sales tax, lack of fare revenues. If you're a particular transit agency, you might have lack of state or local funding that's coming into you. At the same time, our transit agencies had to make a number of operational adjustments that might have caused them to increase spending for their services related to purchase of equipment or more frequent cleaning, or providing additional services that they wouldn't normally provide. As well as we received a number of requests for the public transportation industry to be able to help the community provide additional services such as meal delivery. For the next slide, please. This is when we talk about lost fare revenue, for example. You can see just here the challenges that our industry faced with the drastic decrease in ridership as a result of the social distancing. At the deepest decline in April, we were providing about 20% of daily trips. So it was cut about 80%. Since the fall, it's been down about 60%, and it's stayed about the same. So service levels are about 12 million weekday trips, so much below what the ridership is much below our normal ridership. Let's go to the next slide. So here's kind of a timeline. Early in March, we identified, we put a COVID-19 webpage and established a particular email, FTA response, to respond to questions from the transit industry. We received over 1,000 questions that we worked to respond to. March 13th, they declared the national emergency. And at that time, we increased the flexibility for our formula funds, the urbanized area formula funds and the rural area formula funds, or the 5307 or 5311 program funds, to be used through the emergency relief program. And we had the first major disaster declaration in New York on March 20th. The week after that, the president signed the CARES Act. And at that time, we started identifying ways to provide administrative relief. We had some notices of funding opportunity that were open at the time. For example, the bus program, we extended the deadlines by 30 days for the programs that hadn't already passed. Within a week, actually within 6 days, we published apportionment tables for the $25 billion in CARES Act funds. And the following week, Missouri DOT was the very first grant recipient for $61.7 million. We provided a series of webinars on the requirements of the CARES Act and the eligibility. And then previously, we had increased the federal share for operations under the 5307 and 5311 program to 80%. And in April, we increased that to 100%. to match what was provided under the CARES Act. As of December 4th, we've awarded 763 grants for 23.5 billion. And we've dispersed, as of this morning, actually, we've dispersed just over $14 billion. That's about 56% of the funds. Go to the next slide. So as I mentioned, the first thing we did was expanded or implemented the emergency relief program. And what that does is it allows recipients to use their existing urbanized area formula funds and the rural area formula funds. One, it allowed them to use it for operating assistance in urbanized areas that aren't normally eligible to use operating assistance. We also increased the federal share initially from 80% and then ultimately to 100%. And this was for all funds that were provided. We've, under the provisions of the Emergency Relief Program, operating assistance is eligible for 1 year from the date of disaster unless FTA determines that there's a continuing need. Last week in our FAQs, we identified that there is a continuing need and we extended the eligibility of operating assistance under these flexibilities through January 20th, 2022. And as I mentioned, that's at 100% share for the program. Next slide. So, as grantees continue to utilize the CARES Act funds, some recipients have dispersed 100% of the funds. So this provides some outlet to continue to use 5307 or 5311 funds for operating expenses, particularly tied to responding to COVID-19. The CARES Act funds were more flexible. The operating assistance could be used for any operating activity. Under these flexibilities, the expenses had to be directly tied to coronavirus response. Go to the next slide. And then, as I noted, on March 27th, the CARES Act was provided an unprecedented $25 billion for the transit industry. Funds were provided at 100% federal share. No local match was required. Funds could be used for any activity, planning, capital, maintenance, operating, any expense generally eligible under our programs, but the vast majority of the funds have been used for operating assistance, as you would expect. 22.7 billion went to the urbanized area program for small urban areas, large urban areas, and then 2.2 billion was for the rural area program, which includes 30 million for the tribal transit formula program as well. And the next slide. So what the CARES Act allowed us to do is to pay for, as I noted, any activities normally eligible under the programs, but in addition, any operating expenses, including for recipients in large urbanized areas who aren't normally allowed to use FTA funds for operating. And we noted within there that funds could be used to pay for administrative leave of operations personnel, due to reductions in service or quarantine. So the idea here was, rather than having to lay off staff could be, if they weren't needed to provide service, they could be put on leave. CARES Act funds could be used to pay for that leave, and the staff would remain on the payroll. The funds are available till expended, but we are encouraging recipients to use the funds expeditiously. There was discussions earlier about, future disaster, future appropriations, and one of the things that Congress is interested in is, the pace of obligations, the pace of disbursements of the CARES Act funds, which helps them to determine the need for future funds. So to the extent that these funds can be obligated and dispersed, it helps support that argument. Go to the next slide. This is just a table of the status of obligations and disbursements as of December 4th. As you can see, almost all of the urbanized area formula funds have been obligated. As we expected, the states have additional work in working with the subrecipients in the rural areas, where about 84% of those funds have been obligated, and for tribal, it's about 72%. Many tribes were closed completely over the summer and didn't have the ability to even work on developing grant applications. As the disbursements, as of this morning, we're just over $14 billion. So that's an update from December 4th. So we're still about 56% of the funds have been dispersed. Go to the next slide. So I talked about our frequently asked questions, our FTA response email. I just want to remind everybody that if there are additional areas where you feel you need regulatory or statutory relief above and beyond what we've already provided, every year FTA establishes an emergency relief docket in the regulations.gov. And the docket number is always, this year's FTA 2020 as 0001. We'll be posting at the beginning of calendar year 2021, an updated one for the next calendar year. But this is really the place if you believe that there's a regulation or a statutory requirement that's preventing you from implementing the program. There are some areas where we can grant relief. There's other areas where the statute doesn't allow us to provide relief, but we treat these on a one-by-one basis, a case-by-case basis, and as we see the need, or if there's multiple agencies requesting the same thing, then we turn those into frequently asked questions and grant broader relief across the entire industry. And the next slide. So I talked about some of the things that we've looked at relief for our capital investment grant program. There were levels of service that are required once a project opens for the first 5 years. Obviously, many areas have cut service, so we relaxed that requirement. We allowed contracts that were entered into prior to January 20th that didn't necessarily meet all federal requirements to be reimbursable. Otherwise, everyone would, if a recipient doesn't normally use FTA funds for operating expenses, they would have had to enter into brand new contracts, which would have delayed it. We identified that third-party contracts can be modified to pay for admin leave for operations and maintenance personnel. Indirect cost rates that expired prior to June 16th were extended by a year. We extended the lapse date for some funds that were going to expire at the end of 2017 and 2018. Some of our programs have administrative set lapse dates. Some of them have statutory set lapse dates. And for the ones that had administrative set lapse dates, such as the tribal program, the 5310 program, we were able to extend the lapse by a year. We identified changes to the requirements related to NTD reporting. In addition, it's not noted here, but as we move into an appropriation for FY 2021, we will be using FY 2019 or calendar year 2019 NTD data. So the 2019 NTD data wasn't affected by coronavirus. As we move into the following year, we'll allow recipients to either use the 2019 data still, or to use 2020 data if they feel it's better. We expect most will use the 2019 data. And we expanded the eligibility for essential services such as meal delivery. And we updated our frequently asked question last week to extend that through January 20th, 2022, which is pretty much the maximum we're allowed to do under the emergency relief provisions. And then for the safety and oversight, the Public Transportation Agency safety plans, we deferred enforcement action until December 31st. And the 2020 triennial and state management reviews were postponed in this past year. And the next slide. And I'll just conclude with, looking forward, we'll continue to work to obligate and disperse the CARES Act funds. We have been meeting with stakeholders on a regular basis to understand the needs, identify areas for additional frequently asked questions. So we'll continue to try to identify opportunities for additional administrative and regulatory relief. And as additional relief measures are enacted, we'll work to provide the funds as expeditiously as possible. I just want to thank AASHTO for allowing me to participate today. And I don't know if we're going to answer questions now or at the end of all the speakers.
Roger, we actually have a question.
Great, we have a question. Richard, go ahead.
Katie Patterson from Wisconsin DOT is asking FTA, do you know if there, and this is for Bruce, do you know if there is any anticipated extra assistance for the 5310 specialized transit program for seniors and individuals with disabilities?
I won't predict where Congress will end up with any bills, because they're in constant negotiations between the House and Senate and the majority minority parties. We have identified that as an issue, that wasn't a program that wasn't provided administrative relief. or additional funding underneath the CARES Act. So they are aware of that issue, and we'll just have to see if that's in the final bill.
That is the only question I have so far.
Great. And if anyone has any other questions for Bruce, just drop them in the chat, and Bruce will ask you to stick around till the end here, and we'll move on to Garrett's presentation. Thank you.
Okay.
Okay, thank you, Secretary Millar. Thank you, Richard, and everyone at AASHTO. For those of you haven't had the pleasure of meeting, my name is Garrett Euclido. I'm Deputy Commissioner at the Connecticut Department of Transportation. I want to talk about what we've done here in Connecticut with our CARES Act funding and in general responding to COVID as a little setup. So next slide, please. So really briefly, this is what I plan to cover today. Talk about what we did to respond to COVID, the impacts on our transit system, how we've managed the CARES funds, and then next steps for us here in Connecticut. Next slide. For many of you who probably have never been to Connecticut, this is a little snapshot of what our system looks like. 3.5 million citizens. I think the key for us there is in the middle part, covering the graphic of our state, where we have 2.8 million registered vehicles, but we had 41 million train trips and 38 million public transit trips on our system in Connecticut over the previous year. Obviously, 2020 is going to look a little different in terms of metrics. Next slide. So really want to focus on our bus system. We have 20 providers in our state. That's 5 rural transit districts, 9 urban transit districts, and 6 private contractors who provide service under the umbrella of various services. Our largest umbrellas are CT Transit Express Routes, and CT Fast Track, which is a bus rapid transit system. We also have the ADH paratransit services. Connecticut is a little unique in that we, the CT Transit umbrella is closely tied to us as an agency at Connecticut DOT. It is, part and parcel for the services we try to provide under one flagship brand for the state. And it actually, we are the recipient. We partner with First Transit, who is the manager of the system, but it's a legacy system back from when streetcars ruled our streets. And over the course of the 20th century, it evolved and ultimately became its own little entity that Connecticut currently operates through CT Transit to benefit the entire state. Next slide. So this is a crude map showing all of our bus routes in the state. I cut off the little part in Southwest Connecticut, couldn't fit it, but Hartford, New Haven, and Stamford, which is in Southwest Connecticut, as well as Waterbury and a few other parts of the state, all operate under the CT Transit umbrella. We have other parts of the state, most notably Bridgeport, which is Greater Bridgeport Transit. Bridgeport is our largest city. They have their own transit district there. And then Southeast Connecticut has their own transit system as well, and then some rural transit districts. But I'll come back to this map in a minute. So if you go to the next slide. So I want to touch on what we did here in Connecticut to respond to COVID, and this will help provide the setup for what I talk about when we talk about how we've been managing our CARES funds. So bear with me. As soon as it became clear that COVID was going to become an issue in our nation and in our state, we started having daily meetings with all of our transit providers via phone to talk through preparations, to begin to set a baseline of what type of data we wanted to collect, and to figure out how many supplies they had for PPE and cleaning supplies. During the course of those calls, we collected all that data. The staff of our public transportation team did yeoman's work to try and to pull all that together. Continuing with those calls, we made joint decisions statewide across all of our systems, all of our transit districts, as to when to suspend fare collection and front door boarding, and implement rear door boarding where it was physically possible. The fact that we did that system-wide across the entire state really was helpful for continuity of service, for continuity of service levels, and providing that uniform operation, because many of our commuters, they don't oftentimes know that there's a difference between who's operating their bus. And so to be able to have that uniform rules in place was really helpful from a passenger perspective. We also continue to run full service. We made that conscious decision to try and run full service wherever possible, to ensure that essential workers could get to work at the hospitals, at the nursing homes, at the supermarkets, and everywhere they needed to go. We actually, the map I showed you previously, that was created by our staff here in our Public Transportation Bureau and our Enterprise GIS team here at the Connecticut DOT. That did not exist before, so they worked feverishly to map all the bus routes in the state, getting the data from all of our transit providers in our districts, and laying it into a GIS map, which did not exist before, and then including layers that layered out all of our critical facilities, all of our hospitals, all of our nursing homes. So as we were facing the risk of having to suspend service on certain routes, we could ensure that it did not provide service directly to specific critical facilities. That if we had to suspend service, we would redirect those cuts to underutilized routes that would not impact critical facilities. Thankfully, we did not have to reach that point, but we prepared for that eventuality. Taxi and rideshare service was critical for us as well. We took advantage of some emergency waivers in-house to ensure geographic coverage across the entire state, because those taxi and rideshare services continue to provide a lifeline for individuals to get to places, especially in communities without any public transit. And two other things to flag what we did by partnering daily with our public transit providers across the entire state, coordinating through our transit administrator here in ConnDOT. We were able to get our public transit workers into the state managed rapid testing service that we implemented in April. So every day, every night, I would get requests from our public transit providers asking for them to get specific drivers or mechanics or cleaners into the rapid testing center the next day or the day after to ensure that they could get those rapid results back. That lasted from April until early summer when that state-run site was shut down. But treating our transit employees like first responders was really helpful in continuing to demonstrate our reliance on them as critical essential workers, serving those essential employees who need to get to their jobs. The last thing we also did to show support for our frontline workers was our Office of Early Childhood stood up a Connecticut Cares for Frontline Workers program to provide childcare subsidies for those who had to continue to work during the first peak of COVID. And it was really helpful for our transit employees to be able to get captured under that definition of a frontline worker to take advantage of that additional childcare benefit while it lasted. Next slide. So what's been the impact on transit in Connecticut? This chart here is something I check almost daily. It is tracking our bus system in the state, as well as our three different rail lines in the state. The top line is our bus system. The yellow line is our Hartford line, our newest rail service in the state, running north-south. And then the two bottom ones, the red one is our Metro North, which goes from New Haven to Stamford into Grand Central in New York City. And the light blue is Shoreline East, which goes from New Haven east to New London in Southeast Connecticut. So, we saw immediate drop off in utilization once stay-at-home orders were put in place. Essential non-essential businesses were closed in Connecticut. We were able to use this reduction in service levels on the bus side to maintain social distancing, and by partnering with our state's Emergency Operations Center, Emergency Support Function 7 for all you government folks, ESF 7. We procured PPE, masks, and gloves and cleaning supplies through ESF 7 and provided that to all of our transit systems in the state to ensure they had a constant supply, and we're continuing to do that to this day. That kept our drivers working. It kept services running and allowed those services to be there when individuals started to come back to the service. So bus, you see, we really only, the lowest we ever went was a 55% drop in bus ridership. And through the course of the summer, it picked up. Into the fall, as cases started to pick up again, it's dropped again. But we did things like suspending fares on March 19th at the peak, start of the peak. Started rear door boarding, and back in October, we re-implemented front door boarding and fare collection once we had driver barriers installed in every single one of our buses that could accommodate them. And we did that jointly throughout the entire state for our entire CT transit system. The bottom, the rail side, that's a totally different type of discussion. Many of them are different types of users of our system. They're not entirely transit dependent for the most part. Many of them use it as a commuting option to get to jobs, but they're not 100% transit dependent. Many of them do have vehicles at home. And currently, many of them are teleworking from home. Next slide. So the other thing we did during the course of COVID over from March until the summertime, when we had a reduction in utilization, we partnered with a group called Govern for America to do an equity analysis of transit utilization during COVID-19. That's on the left side. It's located on our public website at the Connecticut DOT. We also did some surveys of users who either stopped using service or were continuing to use service. And we're planning to update those surveys in the future as ridership continues to come back. But for me, what's most critical is on the left-hand side, the equity discussion. The pandemic really has helped shine the light on the best kept secret in Connecticut, which is the critical importance of public transit for essential services and the great service levels already available to individuals. So it's just a critical lifeline for people. And it's often the key focus has been on rail, but the bus side has really shined throughout this pandemic and continued to provide that lifeline service, and really has been able to allow our state to continue to be open. Next slide. So last piece before going over to our CARES funds, as I mentioned, we did purchase driver barriers for our entire CT Transit fleet. We continue to provide helper buses on routes that may have higher passenger levels that will not allow for significant social distancing. We have implemented bi-weekly reports from all of our service providers in the transit districts to report data centrally, which is then given to us in the commissioner's office, including metrics such as mask adherence percentages, any corrective actions taken against drivers who are not using masks, COVID positivity rates amongst the transit district and transit provider staff, the number of helper buses deployed and which routes they've specifically been deployed. We've upgraded our air filtration system. We continue to have every few weeks, we have blanket mask distribution events where CT DOT staff, CT Transit staff, and transit district staff from across the state all go out to central hubs and distribute masks to a lot of our riders and just the general public. We want to get as many masks out there as possible. and encourage utilization. And what we've seen, and I ride various systems in our state every single weekend, and I'd say for my tracking, 90 to 95% mask adherence rates on our buses. Our supervisors who go out and do the count are seeing the similar things, 90, 95 or higher percent mask adherence rates. So, and Governor Lamont actually put in place an executive order making it mandatory. And if you don't use a mask, you can be fined up to $100 for not using a mask on public transportation. That has not been acted upon yet because we've seen such high adherence rates. And lastly, continue enhanced cleaning. So all of this has put us in a good position to continue service, but none of that would be possible without the support of FTA and the CARES funds. So if you go to the next slide. So when this first passed and it was provided to Connecticut and guidance was issued by FTA, this chart here shows exactly the level of funds that were apportioned to Connecticut. We had to figure out how to distribute the $487 million. We are the grant recipient for 5311, as it says there on the slide, and it passes through to the rural transit districts as subrecipients to the department. For 5307, they go out by urbanized area, and we have to have split agreements. And then the intercity cares, that was new for us, so I'll talk about that in a little bit more depth. But all of the cooperation and the partnerships and the data collection that we cemented at the very beginning of COVID lockdown in early March really helped us and our great team here at ConnDOT to work with our partners out in the transit districts and the service providers to analyze and prepare the split letters for our funds. If we didn't have the data collection in advance, and if we didn't have the uniform approach to fare collection, to front door boarding and rear door boarding, to how to handle distribution of masks and getting the masks from state ESF 7, we would be in a different situation and how to approach the distribution of our funds. So if you go to the next slide. So what we did was we decided not to completely obligate the total amount of funds assigned to Connecticut in the first round. We made the conscious decision collectively to use the resources to cover solely lost revenue, because we made the decision jointly as a state to stop fare enforcement. And to cover increased operational costs. So any supplies the transit districts and providers needed, any additional cleaning that was being undertaken. But what we did not do was supplant any existing resources we had planned already in our budget. And we made this decision because we didn't know how long COVID and especially the impact on public transit would last. My concern and the commissioner's concern was if we fully obligated all of our funds in advance, we didn't know what ridership was going to look like. We didn't know when we could begin front door boarding again and begin fare enforcement again. So we wanted to hold some in reserve and see what was happening with the virus and what was happening with public transit ridership. So we're actually just getting to the point now where we are going to assign the remainder of our funds and sign those split letters with the transit districts. And so that would be taking care of all of our CARES funds. And that has allowed us to make adjustments based on what the actual impact to those districts and providers has been. We also use many of the emergency waiver provisions in CARES, both for FTA, Federal Highway, and it did allow us to protect the public in a better fashion. I would say the biggest issue we had was determining how to apportion the intercity funding. We've never had contractual agreements with one of the providers in our state, and we didn't have any information on the private company's financial or operational specifics of their business. So we have two intercity carriers in our state, and what we're doing is taking the total allocation and dividing it between the two providers. we just made the decision to do this by using their 2019 miles they provided for January through June, and create a percentage between the two and splitting it that way based on what they did in 2019, not based on what they did in 2020. I think this is an area where in the future we could definitely use some best practices from other states and how they handled this funding. As a small state, we've never had to deal with the intercity piece before. We did talk to some of our neighboring states and crafted our response similarly along those lines, a little different, but that's an area where further guidance would have been easier and made it possible for us to distribute those funds faster. So before I close out, just want to highlight again, for us, the key thing has been using these funds to cover the lost revenue, which for us was because we knew everyone stopped collecting fares all at the same time. It was easy to anticipate that. We used it based on historical average from each of the transit districts in our state. And we also had routine collection of data in terms of operational cost increases. And we collectively as a state procured PPE and supplies for the transit districts. So that did not have to come into calculation for most of the CARES funds. And I'll be happy to answer more questions as we open it up for questions on this. I think there's a lot to dive into. So if you go to my final slide. So just to wrap up, and then can't wait to hear what Tennessee has to say, but I would just be remiss if I didn't use the opportunity here to thank the FTA for their support during this time. Thank the US DOT for allowing us to use emergency waivers to protect the service and the public. But most importantly, I want to say a thank you to everyone working in public transit across the country. What you see there is while students were stuck home, we ran a student poster contest for kindergartners through 5th grade in our state to thank bus drivers and other public transit workers who we deemed here as moving heroes and essential workers on wheels. And the winners actually had their drawings produced by our sign shop here at DOT and placed at bus stops all across their community to try and put a smile on people's faces as we deal with this collectively. So thank you, and thank you for having me.
Thanks, Garrett. This is Roger. We have a couple questions in the chat. One from Don Chardock at Washington State DOT. What information did you have your 5311 providers give you to determine the awards that you gave of CARES Act funding?
Yeah, so it's been so what we've been using is a lot of the mileage, historical mileage. One of our providers suspended service entirely for a couple months. So that was a difficult part to try and balance out someone that proactively suspended service versus another provider that continued to provide service. So that was a piece that we had to balance, but we collected historical mileage as well as all mileage executed during January to June of 2020. Because we started the process in June, we didn't want to collectively update it every single week or every single month. So we just used January to June, as well as January to June 2019, compared the mileage that was conducted during those times. We did ask them for revenue loss as well. So how much revenue they collected from the routes in Connecticut for 2019, as well as revenue for those routes they execute in Connecticut during 2020, and did that comparison based on mileage. So for 5311, that's really what we asked for those pieces.
And so I'm sorry, just to follow up, just to clarify, and also we're talking about 5311 and not the intercity bus there, right?
Yeah, well, so yes, you're right. So that those were for both the intercity as well as for our rural districts.
Got it. And so then did you end up just essentially using a formula based on miles?
So what we did for intercity was the formula. What we did for rural districts, because Connecticut we basically fully fund. The local share is so minimal that the state provides the matching funds in Connecticut. So we get all of that data anyway.
Mhm.
As the designated FTA grant recipient. So they have to provide that to us anyway as subrecipients. So we used that direct data to ensure, our goal was to ensure that they are continuing to provide service in those rural areas by providing us exactly. And once we knew that fare collection stopped, we were able to determine historically how much revenue they'd be collecting, which is minimal to begin with.
Thank you.
Great. And Garrett, Rachel asked us, you may have answered it already, but just we'll make sure. How did you determine how much was considered lost revenue? Did you compare it just to the prior year, or was there more analysis that went into that?
Yeah, it's a great question. So because we all stopped on the same day of fare collection, it was easy to predict what we would have seen going forward if it was a non-COVID year by looking at 2019 data, 2018 data, 2017 data, looking at those historical trends for those transit districts and how much they collected in revenue. Connecticut, as I said just before, we have an appropriation from the state every year that we then just use to distribute back to the transit districts to provide a large portion of that match necessary for FTA funds. So we get financials from all of the transit districts routinely. So we're able to use that historical data. Our team in our public transit bureau, it's around 100 people that run both the bus and rail system for the entire state, and they do an amazing job. And so they use that historical data to predict what that fare box revenue loss would be because we just stopped full fare enforcement. So it was easy to just use a historical marker there.
Roger, you're on mute.
Well, it's Tuesday. About time I got caught on mute. We are going to move on to Suzanne. But if any of you have questions for Bruce, for Garrett, or for Suzanne, please put them in the chat, or feel free to just jump in like Don did. We pretty good at our etiquette. I don't think anybody step on anybody else, and also be thinking about the benefits and the challenges of the CARES Act. What advice might we want to give as an organization to FTA in terms of how to administer any new dollars that might come our way? And ask those questions, because if you don't ask those questions, I'm going to have Richard reach out and touch people. It's going to be his call, and you will be dancing for the duration of the time that we have. So with that, I'm going to turn it over to Suzanne, and looking forward to your presentation.
Great, thank you. I think this will be a nice compare and contrast with a lot of similarities and probably some interesting differences from the previous presenters. So I'm Suzanne Carlson. I'm the multimodal director here at Tennessee DOT, and I've been here about not quite a year and a half. So I was here about 6 months when the virus hit. Just briefly about myself, I had previously been working in Memphis for a group called Innovate Memphis, which was one of the Bloomberg innovation teams. Worked in Seattle, hi Washtenaw, and in Chicago as well prior to that. So my experience coming straight from an innovation delivery team, I think plays out in how the CARES Act, how our thought process went. So go ahead to the next slide. We'll just keep that up, but I'm going to give some introductory remarks here. Oh, my apologies. We had a little formatting error happen in transition. So the way I was doing my work at Innovate Memphis was we were kind of a consulting arm to government. So we would take pretty intractable problems, of which Memphis has a handful, and then take fresh eyes to them and look at, try to gather as much information as we could and analyze the problem, do a deep dive, and then develop ideas, iterate, prepare to deliver on the ideas, and then deliver and adapt. So have things hit the ground and then see how it works, and then circle back and look at it. So when the pandemic hit, which incidentally was several days after a tornado, which literally hit my house. It's okay, but it was pretty close in my neighborhood, so we were dealing with some twin disasters. We had to move really quickly, as everyone did, and at the same time try to be thoughtful and think of what could have the biggest impact. So, probably a few of you on the call here knew that as a newer director, I was reaching out to folks thinking, what am I missing? What are the opportunities here? What can we do that's both quick and responsive, but also make sure, as Garrett was talking about, that you kind of know what's happening on the ground and you're able to make some adjustments as you go. So I don't have a lot of images in my slides, and I also have nothing drawn by children. So note to self, next time, images drawn by children would be fantastic. Um, we do have transit in all 95 counties in Tennessee. So I think that makes us a little bit different, that we've got coverage through our human resources agencies to cover transit throughout Tennessee, as well as as you see here, our 4 large urbans and our 9 small urbans in the 5307 program. We also get the Appalachian dollars. So this is just here for demonstration. I don't, probably no one's interested in tracking dollar for dollar what we had here, but just gives you a sense of the scale and the different programs that we have in our CARES Act funds. So go ahead to the next slide. So I realized I put all my spoilers straight on the slide here, but we did iterate and sort of think hard about the first 50% that we rolled out. So we kind of decided early on to do it that way, to do 50% and then to get the dollars out, and then do the lesson learn and see what we could learn for the second 50% of our funding. We have 2 tourist areas here in Tennessee. Excuse me, someone decided to call me. Pigeon Forge and Gatlinburg, if you've ever been to Dollywood, they have really robust transit systems there. A trolley that's very heavily serves a lot of tourists, so they actually have really high ridership. So we have kind of an interesting rural system with really high ridership. So for the 5311 rural subrecipients, and like Connecticut, we are the recipient and we allocate out the funds to our subrecipients. We decide to use our existing methodology. If there's one thing our transit providers like, it's consistency. They like to know how many dollars are coming, and how they can use that, what the parameters are, and then hit the ground running with it. So we wanted to, instead of sort of throwing our methodology up in the air and coming up with something new, we used the existing methodology. And we also had just developed this formula a couple years back, and we had just finished transitioning into this full new formula. So for those tourist areas, we sort of take them off the top, given that they do have the fixed route systems and they operate a little differently and ridership really looks different. We allocated them first. We took about a 6-month, no, excuse me, about a 60% of a full year of their operating expense. So we gave them, maybe a little more than a half year of expenses, so that they could stay healthy and keep rolling. I will show you later, they actually didn't keep rolling. They were one system that did shut down early on. After that, we allocated the formula to our human resource agencies and development districts. And you can see here, this is what our formula looks like. Population. We separate out contract trips. We've got very robust TennCare Medicaid contract funding. So we separate those out because they're already paid for, and do the public passenger trips and revenue miles. And then we calculated out what that would mean in terms of operating, to make see how long they could stay healthy for if they were at a full burn, and it ran about 8 months per agency. Some 6 months, and then some more like a year, depending on their cost efficiency, but roughly about 8 months. We also did the 5311F intercity bus study. We had not funded those private companies before. If you can picture Tennessee, it's extremely long, and we connect, Texas to Washington, D.C. We connect folks from the South up to New York and Chicago. So we have Greyhound running very robustly across the state, and they really can't cut those routes. So we have really great coverage through our rurals. So we had not previously funded the 5311F, but we kind of, we did the consultation, but we also learned from our peers. I think we looked to all of you to say, this is what's happening. Greyhound is getting their funding through the 50 states, the way CARES was set up. And so we're going that route as well. We have not executed contracts with them. And we have another smaller provider called Miller Transportation. Actually, Richard, if you skip ahead 2 slides to where it says evaluation, we did, before getting to the second part in terms of sort of iterating and seeing how the dollars hit the ground, we did do an agency survey, as well as keep in constant touch with folks and with our transportation association. Um, so we did a survey in August. Unsurprisingly, everyone said that the CARES Act was helping, that these were really essential funds to keep essential services going. Won't go over this in detail because I think everyone sees the same thing. The primary use was they were spending on administrative leave, quarantine, keeping trained drivers around so that when service, as they had cut service, when service came back, they would still have that driver force. Some were using drivers for the cleaning regimens, but that was the bulk of the expense was drivers, as well as cleaning, PPE, and then of course replacing revenue that had been lost that typically was coming from other sources. I learned through this exercise that when you're someone's funder and you give them a survey and you said, how well is it working? They go, fantastic, your staff is great, super complimentary. So we had to prod them a little bit. I guess one of the agencies actually said, does Suzanne really want to hear what we think? Like, is she really asking us this question? And I did. I really wanted to know how it really was working, not just, thanks for the money. So we had to push them a little bit, but they said, it's working great. It's quick. It gives us the necessary money. It reduces it. It's 100% federal. Um, they did want more information up front. They wanted to know what their full allocations were, what the timelines would be, would their old contracts, their normal formula funds be extended? What would that look like? Would they get any of that money back? What would next year's funding look like? And how long would those contracts be? And what flexibility could they have within all of that? So that was probably the biggest takeaway was, like I said, they like that. They like the transparency as well as the reliability. So they were just kind of looking to have as much information up front so they can make good decisions. So if you go back up the 2 slides, then when we did the second allocation, we just stuck with that same methodology. We said, hey, these are our experts in the field. They know what they're doing. They're delivering service and getting people to essential services all across rural Tennessee. Ridership had not dropped as much in the rural areas as elsewhere, probably partly thanks to the lower exposure, if you will, in the on-demand systems. They're not being exposed to as many other passengers, and distances are further. People really rely on it to get to services. So we did roll out the after taking the 15% out for intercity bus, we gave the additional 35% to our agencies, and we did not hold any back for statewide purposes, which we explored. We thought about safety marketing, like, it's safe to ride transit. This is what some of the protocols look like. We thought about some of those expenses, but we have other funds to do. And I'll say we actually have a very small staff too, so we're not able to do some of the cool things. I took some notes on what some of the other presenters talked about, and if we can get a little bandwidth, would love to know a little more about mode shift and other things happening in the field. But go ahead to the next one on the 5307 program. So in this case, it's interesting. Our formula was undergoing revisions. Many of you know Caitlin McClanahan on our staff, who's been talking about the urban donut issue and how we serve sort of the outlying ex-urban, if you will, areas within the service area that aren't served by our fixed route providers. So we had especially in one area, the Tri-City area, we had a demand response provider providing service who wasn't getting money off the formula. So long story short, they wouldn't get money through the formula. We couldn't really use that because we had a consultant reworking it in real time. So in that case, we went for operating expenses. So again, just keep everyone whole, no winners, no losers, get the money out as fast as you can. So we looked at the NTD data, transit database data as to people's burn rates last year, and rolled out the first 50% in that way to get it out quickly. So again, about 8.5 months worth of full funding. So, and again, just to go quickly over, we did end up redoing the formula, getting that ready by the time we did the second allocation. This is a little off topic, but people seem to be interested in formulas. So we did pretty good public engagement and agency engagement to find out, what did transit mean to their communities? What does it really look like? What's important to not just the agencies, but to the communities in terms of provision of transit and funding of transit. So again, reliability, those sort of predictable variables were really important to them, as well as equity and making sure that low income individuals were represented in the formula. We had a bunch of equity metrics, and we decided to use that somewhat as a proxy for other measures. Excuse me. And then ridership, a little bit of an incentive to keep ridership levels up or figure out ways within their system to increase ridership. So we did passenger trips, passengers by passenger revenue miles, which may be complicated, but not going to get into that today. And then of course vehicle revenue miles, because with our demand response providers, that's an expense. How much area are they covering, as well as where the locals providing match. We do give a little bit of a weight in our formula to the match they're able to provide. And then again, not something to really get into much today, but within the UCAs that have the multiple agencies, we do have a way to allocate between the passenger trips and then the coverage area. So again, trying to weigh between sort of how a fixed route operates and then the higher expenses with mileage with your demand response. Go ahead, next slide. I think I probably have to speed up a little bit here. Let's see, yeah, I already did the evaluation part. So just to give you a sense, we do have access to the information about how everyone budgeted their funds. The large urbans, as probably everyone knows, they got all their money up front. It didn't come through us, and they were able to enter into grants for the full funding. And so you'll see that, as everyone said on this call, operating assistance is the biggest expense, 75% for them. I just highlighted the top two. Everybody was pretty much operating in capital in the urban areas and taking advantage of that 100% federal dollar to buy some new equipment as well. And then on the rural side, a little bit different. It's just called emergency relief operating in the line item. That's still about 75%. And then project administration was a large expense for them as well. Excuse me, without as much coming through on the capital side in that first round. So these were the first budgets that came through. We're just getting the budgets online now for the second round, and they've increased a little bit how much they're putting into operating. It's about 78%, and they're switching from admin over to purchasing more vans on the rural side. So a little bit lesson learned as they've shifted that over a little bit. Next slide. Invoices, and just to look at how quickly people were spending it down. I think again, it's the same situation between getting the money out, getting it used, showing that these are essential services that really need the funding, but not spending it all in one place, as it were. So with some of our agencies drawing the funds from different places and being smart about how they use the 100% dollars, of course, for COVID relief. I mean, there's really nothing happening that isn't COVID relief right now, but also spending against some of their other grants as well. So in the rural areas of this is just the first 50%, they've spent down 55%, as well as the small urbans, which got online April 15th. They have spent down, this is as of end of September, so this is not current to today, because it was quite a bit of work to pull these numbers, but they were at about 40% of their spend down on that first amount. And the large urbans, again, who have all their funds, have invoiced against it for about 32%, with a little bit of variation between our largest urbans and our small urbans. So just, we did feel under some pressure to get the second amount of money out, but we also, I think, as Connecticut pointed out, we're sort of good pacing in that it has taken them a little bit of time to invoice against all the funds. Next slide. So again, this was part of our learning curve. Since we don't run the transit agencies, we didn't have the daily interaction that Connecticut was talking about, but we did set up, which we hadn't done before, but turned out to be really valuable. We did have weekly calls through the Tennessee Public Transit Association with TIP to themselves and also with all the agencies, and we had FDA on there as well. So it was just an opportunity for people to share needs, lessons learned, for us to share with them what was going on with us and when the money was coming and that type of thing. We've slowed everything down to being monthly because it just, got a little repetitive after a while, as do things like wash your hands. And, again, a little where Tennessee was a little different is we didn't really take ownership, if you will, of creating guidance. We're working hand in hand with the agencies on how they should be delivering the service. We really posted, we're not public health professionals. As I said, we have a little bit of a small staff. We really focused on getting the dollars out. They're going to be the experts on running the service. The health departments were going to be the experts on the protocols. And also mirroring what the governor did is his system was Tennessee Pledge. So providing information for a variety of different businesses, whether you're a hair salon, a restaurant, a retail operation, different types of guidance that they issued pretty early for different types of businesses. And and transit kind of fit in with that. And then quickly, next slides, I just have some images of some graphs of how our transit was impacted. Again, these were the tourist areas. They did completely shut down for a little bit there, laid off all their seasonal staff that was getting ready to cart folks around Dollywood. And once we gave them the CARES Act funding, we did request that everybody put their system back online, because if these are essential services, and that's what the CARES Act funds were for, we wanted to see the vehicles moving. So they've been the slowest to bounce back. And I will tell you, I don't know what's happening on the ground right now, except that they are a hot spot. And I would anticipate seeing ridership and fare box go way back down in the future months on this chart. This is through October. Next. Rural agencies, again, with the contract trips and smaller demand response vehicles and need to access services, we saw their ridership, which is the blue here, contract funding, stay fairly steady or take a dip, but then come back into health closer to 2009 with the fare box lagging a little bit. And then next slide. The urbans having lower ridership. Well, let's see, how do we want to say this? The higher loss of ridership and less response of ridership, and especially the commuter routes. I'm sure everyone's finding that white collar workers, including this empty office building I'm sitting in, are taking the bus way less often. And so things like commuter rail have really fallen off, whereas the all day trips and essential workers are still taking transit. So you can see that here. And I would somewhat ignore the fare box dip. I think what happened was we had an increase in fares coming through last fall, with a couple increase in fares and increase in ridership. So that's really just showing the comparison to 2019 more so than anything that changed operationally in October on this chart here. But you do see, as with many other agencies, that that people went fare free for quite a few months. Next slide, or is that my last one? So anyway, just statewide numbers, averaging that all together, you can kind of see what the picture was here in Tennessee. And with that, I'll close it out and open for questions.
Okay, we are open for questions. And while we're waiting for questions, I have a question for each of the three panelists. COVID was kind of a unique experience in all of our lives, has been kind of a unique experience in all of our lives. But, we approached it methodically, programmatically. How are we going to respond to this? What, as you implemented the CARES Act relief, as you were in conversations with your partner agents, what surprised you? And how did you respond to that surprise? I'll start with Garrett and move on to Suzanne, and then I'll ask Bruce if he can get his camera back on, and we'll talk to him too. So Garrett, what surprised you as you move forward?
That's a great question. I think what surprised us here, surprised me, was how fast ridership dropped on our systems. It just evaporated across all of our modes. The rail system, we were down 95. We basically reached a point where we couldn't even count the percentage we were down on our rail systems. It was beyond 95% decline in ridership. How quickly that happened, it happened within a course of a few days. So that really shocked me. But corresponding surprise was how strong our bus ridership continued throughout COVID in Connecticut. And to me, what we did with that is we have been able to reinforce messaging about the importance of bus transportation in our state. It's always been second fiddle to rail service in Connecticut, even though they have almost comparable numbers of total rides, but it's never gotten the attention it deserves. So we've used this, I hate to say it as an opportunity, but it is an opportunity to refocus the conversation about the benefits of bus public transportation in our state, how flexible it is and how critical it is, and why we need to continue to make investments to improve service, maintain service, expand service to unserved areas, and improve the the ride for our passengers. So,
Great. Suzanne, what surprised you?
I don't know if this was a surprise so much, but I think one of my big takeaways was that our rural providers are super solid. They know what they're doing. They stayed on the job. They stayed on their buses, in their offices, and kept everything going. And as you saw with those numbers, continued to transport quite a few people. Um, I would say, to the administrator's remarks up front, the system probably provides a little more comfortable level of funding for rural. So I think they were able to kind of continue on. And, when I talked about the feedback loop, they're a little quiet with us on the phone call. I think sometimes because they're just like, no, we've got CARES Act. We're good. We're good. Like, I think it's really been effective at keeping them healthy, financially healthy. They are not staying COVID healthy as much necessarily to a person. But so I would say that was one takeaway. I think my other takeaway was Richard knows that I kind of reached out early to again, as a new director, like, what do we do here? Like, what is everybody doing? And just trying to get some of the best practices from the field. And I guess sort of went back to the conservative route of doing it the way we had done before. But so I don't know if what surprise there was there per se, but he was at least saying early on people were just planning to push the money out as best they could quickly to get it in people's hands. So I'm actually glad to hear sort of from the presentations today that people were doing this iterative process and people have allowed ways to pivot and respond to the crisis and make the best of it as they went forward.
Great. And Bruce, I know nothing surprises the Federal Transit Administration, but was anything unique in your experience as you implemented these programs?
Yeah, I think besides what Garrett mentioned in terms of the rapid decline, I experienced that from a personal level in the Washington area. They kind of started letting people telework, and I was still coming in, and then all of a sudden you're not taking transit anymore. Everyone's staying at home. But I think from a programs perspective, we tend to work, or we do work with FTA with government entities, either transit agencies that are local government authorities or state DOTs. I think what we heard from was a little bit surprising to me. Maybe it shouldn't have been, but all the private sector's providers of public transportation who aren't normally covered within our programs and the need that they experienced. And so we, after the CARES Act, we started hearing from a lot of, ferry boat operators that are private, or commuter bus operators that are private, or intercity bus operators that you could just see the need across, across the industry, from entities that normally, rely on fares and receive very little support, and our program doesn't necessarily match their need. And I think that was a little bit surprising.
Yeah, privates and the not-for-profit sector too. We heard a lot of that here in Washington State. Gary, there's a question for you from David Harris. Your highest bus decrease of 50% is not bad comparably. Was the drop for regional bus higher than the more localized bus service?
Yeah, so that number is total statewide. Some of our routes were definitely higher, especially the what we deem the express routes, which are more of the office workers commuting in from suburbs into our cities, with a lot of the insurance jobs and defense sector jobs. So there were some that were higher than that, but on average, statewide ridership was around 50-55% maximum drop.
Okay.
Garrett, this is Dave Harris. Richard asked me to chime in personally. So on your regional bus, what we're finding in New Mexico, we're down more like 75-80%. When there's a higher lockdown, we're like at 80, and maybe when things are going okay, we're more at like 70 for regional bus, whereas our city bus services are more at like, and they've been at maybe down 40 when things are good, and maybe 50 to 60 when things are on a higher level of lockdown. And I'm finding that across the country that most that's been pretty well mirrored by everyone. And but your numbers were pretty high, and I'm familiar with Connecticut, so I could see probably why they might be a little higher than other places. But and I think it's a testament to how, like you said, how good your public transportation staff is there.
Well, and I will say on some of those regional ones, we are using this opportunity. A lot of those routes have been in existence for decades and decades and never been re-examined. I think that's forcing us now as an agency to reevaluate some of those routes, and are they going to be the same moving forward? So we're using this time to examine that for the future of those services in the state.
Jim brought up earlier the resolution that the board passed last month about racial justice, equity, diversity, and inclusion. Are you seeing some trends in ridership and the need for resources and the like looking at the intercity passenger rail decline versus the bus decline? That would be people that don't have to work, that can work from home versus essential workers or people that need to be out there. Is there an equity perspective to this that you could share?
Definitely for us in Connecticut, that's been a driving message we continue to try to spread with our legislators. The governor's office is keenly aware that this has pulled away the layer of equity discussion we need to be having in the state with respect to transportation. So it's been more clear than ever. And the research project that these grad students did for us with Govern for America, what they did is, it's really interesting, where they took all of our ridership data, which is broken down by bus stop location, and overlaid it with ethnic data, with income level data, and age data, various different layers to calculate out what that ridership based on stop is showing us in terms of equity, and who's riding and who's not based on the demographics of those specific street locations and census blocks. So it's more clear than ever, the equity piece, and why we should be making more investment in the bus public transit sector. And that's us as an agency going to the governor's office, going to the legislature. We're making those requests now for our upcoming budget and for capital investments specifically to address those inequities.
Great. Suzanne, how about in Tennessee?
Yeah, we haven't really had the bandwidth or the data to take a look at that, but we would love to. I think we're seeing some of the same things in terms of reevaluating how service is deployed, whether there's opportunities in some of the more rural areas for fixed route, some consistent destinations and origins that might lend themselves to creating more of a fixed route type system, and how those communities can serve more riders and serve them better. There's certainly the class factor. I think you can see that in rural areas, there are more people relying on public transit and staying the course and keeping the ridership up, whereas in the urban areas, it has declined. So it's something we definitely want to look at more. I think, in Tennessee, some of our rural areas are quite white. And so the, higher African-American population is going to be in some of the bigger cities. And then to your point, those are the riders that are continuing to ride during the shutdown. So I think once we tease that out, we'll find some interesting information there. What we're able to do with it, maybe a different story. I'm hopeful that we'll continue to see transit money flow and increase, please, fingers crossed. There's talk of stimulus, and to me, in this era of climate change, equity concerns, and resilient investments, I think transit looks like the smart bet, more so than maybe new construction of roadways in particular, which has been a little bit more of the focus in our communities.
Yeah. As we talk about this, the lessons learned from the CARES Act, we've talked about the different approaches states have taken. Bruce, this would be a question for you. Just as FTA, obviously you don't know yet what the Congress is going to do, because I don't think the Congress knows yet what the Congress is going to do. But what would you appreciate knowing from the states as recipients of this funding of our experience with the CARES Act that would enable us to, partner to do an even better job, assuming some more money comes our way.
Right. I think it's related to some of the, this is the opportunity as we're working on a bill to determine are there areas within, so say they do provide funding for 5310. Are there areas within 5310 that if they provide funding that we would want language included to make it easier to administer? The same as if they continue to provide additional funding to 5307 or 5311. So for example, if you think of 5310, there's a requirement that 55% of the funds be used for capital expenses. Well, we're in a time right now where the focus is on operations. So you may want to provide additional flexibility. The funds can be used for capital or operating, but not require that 55% of the funds be used. So there's a number of, within the statute, there's a number of legislative requirements within the programs, 15% set aside for intercity bus and 5311. Are there areas where the states, as they've implemented the CARES Act, where they've identified some of those things as impediments to providing funds, as effectively as they would have liked because of those requirements?
Okay, well, those are some things, Richard, I think we can provide some feedback to FTA and perhaps as we're talking to people on the Hill as well. There's a question from Amy about the benefits of statewide procurement versus individual agency procurement on PPE. And I think just on PPE and then just in general, we tend to be grant administrators and our transit agencies desire and have a great degree of autonomy. But as we've done this, what have you seen benefits to a standard statewide approach, or are you continuing to let the the agencies do what they do? I'll ask Suzanne first, and then I'll hand it over to Garrett.
That's funny. I was going to pass because Omni works for me, so I think we're interested in hearing what other states have done. We didn't do any centralized procurement.
Mm-hmm.
Although once we had, good resources, we passed them on to other agencies and helped share around the information. We do statewide procurement for vehicles.
Mm-hmm.
So if others had experience doing that, I think it was really the time and the turnaround time to get those pushed out that would have been a barrier for us.
Okay. Garrett, and I might put my colleague Don on the spot too, what happens in Washington State. But Garrett, how about in Connecticut?
Yeah, I mean, we're a small state, so it might have been easier for the distribution side, but we leveraged, because we got hit so hard in the beginning, I know like Washington did, and our sister states on the Northeast, the lack of availability on the market for a lot of the PPE, it was easier for our transit providers to just use us to get the handoff. So we were able to use our emergency ops center, our ESF 7 team, which was collectively purchasing for the entire state operation. We would put in those requests for quantity through them, and through one centralized warehouse in the state, they distributed it to our centralized warehouse, where we have our crews that routinely manage all of our salt supplies every year and all of our other commodity supplies. So our team that is our warehouse and stock supply folks, they manage that for us and distribute it out to the transit providers directly. And that allowed us really to continue the service, because I think if they had to go out to the private market and try to scrounge up supplies for their workers, it would have eaten away at their revenues at the time. And so it was just, we had sources, we tapped into those sources through the state procurement method, and we're able to get it out seamlessly.
Okay. Don, how did we do?
So it's interesting, in Washington State, the state actually, at least at first, didn't do very much in this area. The Transit Association actually went out and did a procurement for all of the transits in the state, and using just local dollars. And of course, that gives them a little bit more flexibility, as opposed to if you're using federal dollars to buy these PPEs. And then and now what's going on is everyone's kind of gone on to their own thing. And in Washington State, of course, we have the Department of Enterprise Systems, and they are kind of like the central procurer. And so I'd have to admit, I'd have to go and look and see what they've done since, but I can only imagine that they've done some procurement on PPEs that the transits are eligible to buy off of.
Yeah, but I think for the public transportation divisions of the various DOTs, which tend to be rather small relative to the overall organization, leveraging your procurement and distribution capacities, just generally, like Garrett said, SALT, we're good at getting that stuff out to every corner of the state, and leveraging that to work with the transits is something to consider going forward. So Richard, we've got maybe 4 minutes left. What I wanted to do first of all is thank the panelists. Great stuff, great perspective from a very urban state, from a long, thin state. I have family in Germantown, Tennessee, so I'm familiar with. I used to make the drive from Charlottesville to Germantown and back, and boy, you get into Tennessee and it's like a whole day. And
It's like Montana, it goes on forever.
Yes, it does. And Bruce, thank you again for the federal perspective. I want everybody on the call to be thinking. There's a conversation going on Capitol Hill right now about the potential for relief. There's also the potential, as you heard earlier, for some kind of stimulus coming after the first of the year. We learned a lot from the CARES Act. It provided a lot of positive aspects. As we anticipate new tranches of funding coming our way, how can it be better? What advice would you give Richard to give Brandy and Jim and others as they're talking to the agencies and as they're talking on the Hill? That's stuff we need sooner than later. So if you've got a particular issue, please let Richard know about it, and we'll pass that along. And I hope you're enjoying our format and the topics. We are going to be doing our next session at 2 p.m. Eastern, different ways to measure transit success. I encourage all of you to take a little break and come back and join us for another great session. And with that, everyone, thank you very much, and we'll see you a little bit later.
Thanks, everybody.
Thank you, everyone.